pathways. But after the age of what does young mean? Young means, to me, actually means anybody, say, who is less than 30. But as far as studies that we already have between age and accelerating growth at the right time versus the wrong time, so there are some studies, not a lot, but there are some. So the magic range that I consider evidence-based is between 50 and 65. So even though I mentioned that anybody under 30 is fairly young, and over 30, for my own reasons, I know that you're no longer young, whether you realize it or not. But from a evidence-based point of view, particularly with research on certain cancers, is that below the age of 50, you can get away with more of the things that activate growth. However, after after 65, you can also get away with it. So let me be clear, because I stumble a little bit here. So before the age of 50 and after the age of 65, if you had more protein, it's actually good for you. So particularly elderly people, when they have more protein, they activate mTOR. They have more muscle mass, they have more stability, less likely to fall. They actually do much better. When you're younger than 50, which is young, I'm over 50, but I still feel young. It's okay to have a moderate amount of protein because, again, for the same reasons, it's anabolic, it helps with the growth factors, it's good for you. But between 50 and 65, if you eat excessive amounts of protein, you're turning on mTOR, and mTOR can turn on cancer. So examples of this is like people that have a lot of dairy. Now, dairy will activate mTOR, and dairy has been known, particularly in older people, in men to get prostate cancer and women to have breast cancer. So you really have to be careful about excessive, right? And frankly, if you just don't do excessive, you'll be fine. You'll be fine. But in America, bigger is always better. Except about this presentation, you'll understand that bigger and more is not always better. So, so in this situation, the hands down, no matter what age you talk about caloric restriction, that means caloric from all comers, you will live longer and have less disease. But of course, that's very difficult for the average person. And fasting is also difficult. So how can we recreate that? Well, you do intermittent fasting. Intermittent fasting can be from 14 hours, 16 hours, 18 hours, 20, 24 hours, because then you can go ahead and eat. Some people would describe that as timed feeding, that in a certain window of time that you can eat. And that some people say, well, if you have 8-hour window of eating, then there's 16 hours of intermittent fasting, right? Or time feeding. And for my part, I tried not to think about the big window. I just think about my, time feeding, but I eat one meal a day. Now, in between, I'm having, just black coffee. And so you can have beverages, you can have herbal tea, you can have some soups. And frankly, you can actually have fatty things and not break your fast. What are examples of fatty things? Things which are high in fat are like olives and olive oil, or coconut and coconut oil. And, things that are oftentimes the bars that I give my patients, we call them keto bars because they're primarily fat and protein, more fat than protein. So you can actually keep the fasting system going. It's like tricking the body. So that's another way, right? So longevity, for sure, especially as you get over 50, and certainly if you start even younger, time feeding or fasting would be a phenomenal way. The other way is exercise. Exercise, now we know so much data on exercise. What is exercise? Exercise is more than just pumping blood through your plumbing system. And, there's nothing wrong with that. It actually creates nitric oxide. So when you pump blood around your body, particularly around angles, we call those shearing forces. So as these shearing forces of blood going through the blood vessels, it releases nitric oxide. Nitric oxide is a good vasodilator, opens the arteries, so more blood flow can go to the brain, the heart, the muscles. It also is an amazing antioxidant. Nitric oxide activates your immune system. There are 3 types of nitric oxide. The one that you get from exercise is called endothelial nitric oxide, or really the enzyme is the NOS. So there's another little secret of longevity is if you can activate sirtuin through fasting, and then you can activate nitric oxide through nitric oxide synthase. I can never say synthase. NOS. So people who are familiar with NOS is nitric oxide synthase. And nitric oxide synthase, there's 3 types. There is the endothelial, which means that through exercise you can release nitric oxide. There is the neuronal. Neuronal means you even have your nitric oxide specially for your nervous system. and that's called neuronal NOS. So it's such an important enzyme. And again, this is the longevity enzyme. The NOS is the enzyme, and you want to preserve it. And you can preserve it by activating it through exercise. You can preserve it actually by also fasting. There's a lot of overlap between these things. And the third part of the NOS is called the INOS, inducible. This is a double-edged sword. So the INOS actually can work in your mitochondria, because when you can induce nitric oxide, you can actually create so much nitric oxide, you can kill invading pathogens. But so in small amounts, it supports your immune system. That's why it's called inducible. It actually supports your immune system. But part of your immune system is designed to also destroy, right? Seek and destroy. So that's your INOS. And sometimes when you have smoldering immunological problems and you then get oxidation, which is really the prerequisite to heart disease and hypertension and even neurological problems like strokes, that oxidation is synonymous or found to be coexisting with INOS. You know, for people who think they're doctors, who think they practice medicine, and you're actually, if you don't know what I'm talking about, you're actually one step behind. So the things which are chronic, like immunological derangement, even though they think that's for the immunologist or the rheumatologist, they're actually wrong. It should be for the cardiologist. It should be for the GI doctor that's treating his inflammatory bowel disease, because all these things that create inflammation, like inflammatory bowel disease, lupus, rheumatoid, psoriasis, even psoriasis, you actually have more heart attacks because of inflammation. And here we were talking about longevity. Well, the one way to have longevity is don't get disease. The other way to have longevity is don't have a heart attack. Isn't that amazing? You know, rocket science, preventing disease. But the problem is with medicines, you don't prevent disease. With medicine, you can merely control disease. So there is some value, but it's a very measly 25% at most. I'm raising my voice too much, so let me calm it down a little bit. All right. And then, you know, feel free to ask questions about stuff. I know people want to go live, and one day we will again. I like going live with live questions, but keep the questions coming. And the other one is so far in you know, the title is, what are the three most powerful pathways to activate longevity genes, or the first you got to know what those longevity genes are. So sirtuins, heat shock proteins, and nitric oxide. And so heat shock proteins is what I want to talk about now, and the activities are one and the same. So the fasting, and then exercise, and now heat would be the third one. There's actually many, but you know, I'm trying to keep it simple and keep people to follow. So heat is amazing. And you know, I used to hate heat because even though I came from a hot country, I got acclimatized to the dreary or cold weather of the United Kingdom. And so I actually dislike direct heat. I get headaches sometimes. But now that I understand the value of heat, I jump into the sauna any opportunity I get. In fact, after I finish my workout, I go into the sauna for 30 minutes, because when you get heat, you create heat shock proteins. Heat shock proteins are one of those things that activate longevity. Heat shock proteins actually cleans up your old senescent cells. So if you listen to my live yesterday, I talked about aging. One of the things that create aging, or 5 ways to slow down aging, and that is that, you know, as you get older, you get more old cells that just keep on building up. Those old cells are called senescent cells. You need to clean them up. You can clean them up by activating heat shock proteins. By exercising, you can create heat shock proteins. By jumping into a sauna, you create heat shock proteins. In fact, even fasting activates heat shock proteins. So really, the moral of the story, that the three activities of fasting, of exercising, and the heat or sauna is really saying that they are all temporary stresses. And those temporary stresses are the key to activating longevity through sirtuins, nitric oxide, and heat shock proteins. Just 3 this time, and then we'll talk about more later on. So aren't nitrates cancerous? Well, yes, if you get them from your smoked turkey and your smoked salami and all the rest of it, yes. And nitrates, unfortunately, can be troublesome, because in your food chain, they add a whole bunch of nitrates to the soil, so your green vegetables become bigger and greener and blah, blah, blah. But the problem is that, you know, there is some value of getting some of that nitrates, but the nitrates alone is not the way you make nitric oxide. first you eat your green leafy vegetables, not your cold cut meats and getting nitrates that way. Those are cancerous, correct. But your green vegetables, they are your nitrates. Your bacteria, your microbes convert them to nitrites. And then, interestingly, your acid in your stomach release nitric oxide. So people who are taking proton pump inhibitors like Acifex and Protonix and Nexium and things like that, they are going to shut down your acid production in the stomach, which actually will stop your body producing nitric oxide. And if you can't produce nitric oxide, you have less blood flow, which actually can accelerate hypertension. So again, if you have doctors out there who are treating your hypertension and they don't understand the connection between the acid, stomach acid, and nitric oxide, they are doing a disservice. Now, the first thing they're going to say is, oh my God, but we got to give you the medicine because you have acid reflux. No, doctor. What you need to do is fix the stomach so that I don't need the medicine. What you did, doctor, is control the symptoms for a short period of time, and evidence-based medicine says that you must stop that and go back to lifestyle. But when they stop it, because they never gave you the instructions to how to fix your stomach, then they say, then of course you got to be on the medicine. No. The doctor needs to be educated in understanding the CDC guidelines, which is that within 6 weeks, you should stop those medicines. And within that 6 weeks, you have time to adjust your lifestyle. And lifestyle, sorry, I don't want to talk too much about reflux. Oh my God, that sounds loud. Whoa, aggressive. So what was I saying? So, I'm just throwing that out there because such a common problem of people with dyspepsia, acid reflux, gastritis, and the doctor thinks he's so smart in giving a prescription. And, I know those prescriptions real good. I even know Carafate. I even know, there are the H2 blockers. There are so many things, but they're temporary. They're temporary, so you get time to make the changes because, of course, you want to relieve people of their distress. Yep, exactly. Look, it's for me, it's I'm having a lot of fun, but for people, it's a very, very serious thing. The stomach is at the root of all of these things, anybody who doesn't understand that's going to have real health issues. So the main thing is that the GI doctors are in a very powerful position to make some of these changes. And by the time you see a GI doctor, unless it's for a screening colonoscopy, they're what I consider doing malpractice by not educating people about the microbial flora, how that is such an integral part of inflammation. And so between the gut and the liver, as you've heard me say over and over, that's inflammation. So if you have inflammation, Motrin and naproxen and Aleve is not going to cut it. So you have ignorant, I call them illiterate doctors, that I'm talking about physicians really. They're illiterate because they're so dumb. They don't understand that that's truly not an anti-inflammatory. It's not going to touch your C-reactive protein or HSC reactive protein. You have to understand the root of where the inflammation comes from. If you don't understand that, how can you fix it? In the same way, when I started by saying activating the longevity genes, you have to know what damages the longevity genes. I believe that is the real problem. That is the thing that's actually stopping people from being healthy. That is what's actually causing them to have what we call premature aging. And the premature aging is what's giving them premature disease. And the disease is not because you didn't see the doctor. The disease isn't because you reached above 50. The disease isn't because you didn't take enough prescription medication. The disease is because you damaged the enzymes that would have extended your life to the optimal, really, as far as I'm concerned, but you damage it by having too many sugars. You damage it by excessive lifestyle. You damaged it by having too much comfort and not intermittently stressing your body, not exercising. So exercising isn't to kill yourself, but it'd be nice to get the blood flowing to release nitric oxide, and just for a little bit, put a spurt in there, and that can really go a little higher. So your spurt is your spurt, not like a endurance athlete his spurt is so much more powerful. But it's not about that. It's tricking your body to activate longevity genes. So when you're exercising is good. When you add a little bit of high intensity to that, only a little bit. So what they found with people who live to over 100, we call those the blue zones, that they weren't marathon runners. They weren't like optimal. They weren't Adonis. They didn't have six packs. They were basically people who generally stayed active on their feet. And just for a period of time, maybe an hour in a day, they maybe used a little bit of exertion. And an example would be they would go down to the water to bring the fish back up the hill. That's kind of old school. No one does that now. But the principle is sound, that you just have to be fairly active, stand on your feet. People who stand for 8 hours a day live longer than people who don't. Right, so these little simple facts make a big difference if you use them as an overall principle of having a very balanced life. No one says you have to be on tons and tons of vitamins, and I can do that for the next presentation. Is talk about which vitamins can activate those longevity genes on top of the lifestyle. So we'll answer that next question. The next question. So these blue zones again is that you people want to talk about olive oil, fine. You want to talk about beans, fine. If you listen to Dr. Grundy, beans are the worst things in the world. Well, long before Dr. Grundy came, and thank God, we had knowledge before Dr. Grundy. Beans didn't kill the people, and lectins. So we'll see what they mean when we get some hardcore evidence. But my thought is that, like with everything else, it's going to end up being in moderation. For some people, it could be harmful, but as far as history goes, and as far as blue zones go, they all actually eat beans, and they live and they do very, very well. So blue zones is basically people who are relatively active, not sedentary is the operative word. And I've got some studies for that for you, just because of COVID. Not being sedentary is the key, and then activity for a period of time. Just maybe half an hour, where you do, and then that's like saying a regular exercise with a little bit of high intensity interval training. Now, what's the thing I just mentioned about COVID-19? What they said was that not only is it a risk factor for typical risk factors for people who get hospitalized because of COVID or die because of COVID, like old age, like if you are a transplant patient, like if you're on immunosuppressants or have cancer diagnosis even. That's obvious. And I used to be one of them, saying that, heart disease and diabetes and blood pressure was the real risk factor. Well, guess what is actually a bigger risk factor for hospitalization and dying of COVID? Is sedentary lifestyle. So what is the definition? Sedentary lifestyle, let's go to the opposite. People who exercised over 150 hours a week actually had the least amount of hospitalizations and the least amounts of deaths. We're not talking about vaccinated patients at this moment, just giving you the evidence. Now, sedentary means that doing definitely less than that, but people who don't do any exercise at all, they are actually at higher risk of getting hospitalization as well as dying from COVID, even beyond diabetics and blood pressure and cardiac disease. So in other words, if you have diabetes and you have cardiac disease and you have high cholesterol and you have high blood, don't fear, just be active. And that will actually lower your sugar, lower your blood pressure. And that's what intermittent fasting was proven by Dr. Longo. What he did was he created a 5-day fast, which involved just 500 calories, but primarily from fat, no refined carbs, or very, very, very little. And they would just do that for 5 days out of a 30-day month. And they did that for 3 cycles, 3 months. So that means 5 days per month for three consecutive months. And they were able to reduce inflammation. They were able to reduce high blood pressure. They were able to reduce the weight. They were able to reduce sugar. It beats everything. And now I see lots of medical presentations, and they are going round and around and around. Well, maybe it's good, maybe it's not good. You just got to understand that the fact is that it's looking at you in the face, and the fact that you're going round and around is because you've done the wrong variables. You didn't give the right advice. You're looking at the wrong data. You can look at any data you want. Let's answer the question here. Can you tell us how to do intermittent fasting? Should we eat only twice a day? Is breakfast part of it? So it really doesn't matter if it's breakfast, lunch, or dinner. You should choose the meal that you like the best. The only thing I would have warned you is that generally the breakfast and lunch tends to be the things which are man-made, packaged, and refined. Why? Because people are on the run, on the go. They got to go fast. Fast for breakfast, fast for lunch. That is the problem. What an example of that would be: they're eating toast and running. They're having, I know you don't do it, but Pop-Tarts, just to give an example. Or they're having sausages or bacon, or they're having cereal. I had an autism kid, it's not the kid's fault, that the parents were still feeding them dairy and cereal. It's like, well, that is the big no-no for autism kids. Why? Because you're stifling the gut microbial flora. So with autism children, they have excessive amounts of serotonin in the gut, which makes it irritable and inflamed, and they have a lot of stomach problems as well as pain, and they have insufficient serotonin in the brain. That's why the brain is not calm. So it's all to, not all to do with that. A diet is a big part of how to manage it, because autism didn't happen because of your diet. Autism happened because of genetic changes in utero and maybe even preconception, and it's that mother's immune dysregulation which crossed over to the placenta and then disrupted the neurotransmitters in the brain. So by the time the child was born, the destiny was already stamped on their DNA. And so within a short period of time, I believe people can even detect autism in the first few months of their life because they're just not behaving like normal children, which is unfortunate. But again, it's never too late means that, to manage it, you have to understand that you have to control those environments. Anyway, I didn't want to talk about autism right now. So I took my second shot of Pfizer vaccine last week, and since then I've been short of breath here and there. This hasn't happened to me in my life until I took the vaccine. Yeah, well, look, I do actually have quite a bit of information. I'm not an anti-vaxxer or anything like that, but because I do a lot of monitoring on my clients, because my clients not only take advantage of the annual executive physical, but they're on monthly memberships, which is incorporating a diet plan, supplemental plan, vitamin plan, IV plan, and then for my ultra people, they get the top of the line. So I'm able to do monitoring on a regular basis. So as they got their vaccines done, because some of them are quite a bit older, some of them have pre-existing conditions, so they chose to do the vaccine. That's perfectly fine. What happened is that one of those examples was somebody who's very young, no medication, no underlying problems as far as I could tell. They actually had significant fatigue. They had shortness of breath. They had no energy, and it lasted for almost 2.5 months. So what I did was try to reactivate the mitochondria by combining hyperbaric oxygen chambers with intravenous vitamin therapy in a consecutive manner. Within, I think, 2 doses, she had recovered. So I would say that what's happened is that the immune dysregulation has stunned the mitochondria. Give it time, it'll probably get better. In the meantime, you could fast. The fasting will activate your mitochondria. The fasting will activate your regeneration and your longevity genes. So that will clean up your body, so that you'll have a better chance of recovering. So somebody said, what is fasting? How do I fast? So I started by saying breakfast, lunch, dinner. It doesn't matter which one you have, but just stay away from refined foods, packaged food. So that's why I say that whatever you have for dinner, which tends to be something that is wholesome, right? What is wholesome? You eat a clean piece of protein, a salmon or tuna or chicken or steak, whatever is clean. You have clean protein, you have clean vegetables, you have clean starches, hopefully complex carbohydrates. So in other words, you could have that for breakfast. You could have that for lunch. But my point is that don't be eating sandwiches and wraps and processed food. And then, that's just not a good way to have your 1 meal or 2 meals. Now, so no matter which meal you have, so have that window where you eat your favorite meal, so you can go an extended period without eating much. You can have drinks. You can have beverages. You can have certain fats like olives and olive oil and coconut and coconut. So fats are acceptable. And so egg yolk would be potentially part of that, frankly. So having certain things like that. So, avocado, we actually, for my breakfast, I left avocados. I left some smoked fish. I actually had a little bit of meat for the kids as well, because, kids need a little bit of variety. So they can pick and choose what they wanted to have there. So I would say that intermittent fasting is basically you deciding which meal you like, so that the rest of the time you don't miss it as much, so you can last 12 hours, 14 hours without eating another substantial meal. Then go ahead and have whatever you enjoy. You enjoy your breakfast, that's fine. You enjoy your lunch, that's fine. But not at the expense of eating, wraps. So I see people going to a Chipotle, which is great. And then I see them with a big old tortilla, enough to feed a family in my mind. And then they stuff it with rice, and then they stuff it with beans and stuff. It's like, oh my God, that's like 3,000 calories right there. But I don't have a problem with the calories. I have a problem with the refined carbohydrates. That's what I have a problem with. Okay, so if you can substitute, that's better.
So they only eat once a day.
Yeah, so intermittent fasting is time feeding. So, the question was, do you eat just one time, or do you just eat during that period of time? I choose to eat the one time, well, once or twice, but within a much shorter window of an hour or 2 max. And then other people say, well, I want a window of 4 hours, 5 hours, 6 hours, so I can eat this and eat that. That's up to you. That's still time feeding, but I think that it's far superior to do intermittent fasting when you eat your meal and whatever little snack or a little bit of fruit, whatever you want to do, spread it out so you're not like cramming it in half an hour, 1 hour, but then don't be grazing over 6 hours. I mean, that defeats the whole object, frankly. Is turmeric good for inflammation? Yes, it's supposed to be very good for inflammation. So I'm glad you said turmeric, because a lot of people use what we say curcumin, and that was what we used to think was good. But the whole turmeric is better for you, because the microbes in the bacteria in your gut, the microbes in your gut, they love the whole turmeric. They love the fiber of the root vegetable, and they can better absorb the curcumin into your bloodstream. So not only does it nourish the gut and the microbes, which themselves can reduce inflammation, then the curcumin enters the bloodstream, which has anti-inflammatory. Not only is it anti-inflammatory, it can also probably alter the denseness of the LDL particles, particularly the lipoprotein little a, which is a very dangerous, dense molecule, worse than LDL, worse than dense LDL. It is the most atherogenic, the one that creates multiple blockages, even in people who are getting treatment. And so turmeric can be added to an antioxidant combination to get better results. So, don't imagine that I'm an anti-vaxxer. I'm just saying that whatever you take, you must be aware of the positives and the negatives. And it's like I have somebody who's going to come in and talk about lymphoma. Well, whether they go with a conventional approach or not, having an approach like mine can not only give them better outcome with the treatment, but they can mitigate the damage of the treatment. So if you're getting chemo, you increase the risk of heart attack. You just increase the risk of blockages. You just increase the risk of impacting your immune system. So the point is, I know the chemo doctors hate you taking natural stuff, but my point is that whether you decide to take something, it's not about even taking it. It's about conducting yourself in the way we just described in the first 15 minutes about what not to do to damage the longevity genes. Then what to do. You can still exercise. You can still eat, but do time feeding. You can entertain, get yourself into in a sauna. Those are things that should be complementary in all hematology, oncology practices, if only they understood how the body works. In fact, they should be the first ones to know that the body didn't do its job right, hence why you got the cancer. That's called checkpoint inhibitors. There's a drug for it, so they know we have what's called checkpoint inhibitors. You damage it by not sleeping. You damage it with toxins. You damage it with a high glycemic index. You damage it with all the things we just said make you age. That's why aging is a risk factor for disease. I mean, it's just common sense. But of course, that's lacking in the medical world, no doubt. So listen, so if you are a hematologist oncologist, you're going to one, you have to ask them these questions. Now, I know they don't like the idea of you taking a vitamin and this and that. They don't know how it's going to interfere. It's not about taking anything. It's about conducting your lifestyle. If the doctor says, eat whatever you want, have some booze, have some Ensure, have as much carbohydrate you want, there's such a dumb doctor, you need to fire them. Because any doctor who's an oncologist allows refined sugars is really doing malpractice. You're turning on inflammation by having spikes of insulin, and insulin spikes not only create insulin resistance, which causes blockages and dementia, but actually can accelerate heart disease. So much to say, so little time. All right. Okay. So look, just summarize for people coming on, is that we were talking about the 3 powerful ways to stimulate longevity genes. And those 3 powerful ways are exercise, particularly if you incorporate high intensity as a small burst in that period. And that can just be 1 minute, frankly. And then intermittent fasting or time feeding, just decrease the caloric intake. Don't keep stuffing your body at all times. That will do it. And then heat in the sauna. Exercise causes heat. That's why I told you. Fasting makes heat shock protein. Exercise causes heat shock protein. Heat, like sauna, causes heat shock protein. So those enzymes that are for longevity are sirtuins, heat shock proteins, and nitric oxide. And so those are very, very important. And if people, like the medical people, think that, oh, this is just theoretical and this is just sort of, alternative, or this is about, no, it's actually medical. This is the things that you're supposed to do to prevent the disease. So if you go to the doctor and you get annual physicals when you're 20s and 30s and 40s, and then you get diagnosed, it's because your doctor was incompetent, because he didn't predict and prevent the disease, did he? That's a problem. So as a doctor, our job is also to prevent disease. Just doing a physical does not prevent disease. It picks up disease when you get it. And by the way, it's not early. You'll have had to damage many things before you get the high sugar, before you get the high blood pressure. You've actually damaged your nitric oxide. You've actually damaged your insulin receptor, we call insulin resistance. So by the time you've got the disease, it's not early. You've actually damaged many, many things. So again, just I'm being a little bit confrontational, but the point is that no, this is not alternative. No, this is not just lifestyle. No, this is actually preventative medicine. And 10 years ago, maybe you could somebody could accuse us of, oh, this is just lifestyle. There's no evidence for this. Well, unfortunately, you have to catch up with the times. Now there's lots of evidence to not only measure the epigenetic age, but to tell you that when you're advanced in your biological age, then you can't get fertility. When you're advanced in biological age, you're going to get osteoporosis. When you're advanced in your biological, remember I said biological age. I don't care if you're 40 years old. You can have a biological age of 60. So osteoporosis, diabetes, dementia, arthritis, you name it. These are all age-related diseases. Now, not everything, but most things. And your doctor is so-called treating them. No, he's merely controlling them. Did he ever fix anything? No. Why is an endocrinologist's office full? Because he never fixed anybody. That's why. That doesn't make a good doctor. That makes an incompetent doctor, by the way. And, I'm being funny, but actually it's serious because it really is what's going on. Why is a rheumatologist full? It's because they never fixed anybody, did they? That's why they're full. And they get full very quickly because they're so incompetent. They don't change the lifestyle. They don't tell you where inflammation comes from. They don't tell you that the insulin receptor is damaged by inflammation. So when I turn off inflammation, the blood sugar comes down. The blood pressure comes down. I don't even have to use any medicine, nor even any supplements. I lie. I use a few supplements to accelerate, to support the immune system to bring down inflammation. I really got to sit, because I think when I get so excited standing up, I bounce around way too much. So when I'm sitting, I can't bounce around as much. Is fish oil or sea moss good for anxiety? Well, I think that you are on the right path. So your brain is made out of 75% fat, particularly the nerve sheaths. So there's studies to show that EPA with vitamin D supports serotonin, which is good for sleep and relaxation, calmness. So I think you're on the right track. But frankly, DHA is actually also supportive for the brain. So I do both. What's the point of just taking one or the other? And now, lo and behold, we even have a study to show that EPA can prevent heart attack, actually prevent heart attack, even before you've been diagnosed. Now that there's a drug, all of a sudden it's very good at preventing. But remember what a drug is. A drug is no more than what nature does, but they've compounded it to make it stronger. So the answer is that EPA, the reason it works, they use a higher strength. Well, who says that's rocket science? That's what I do. So when I use vitamins as therapy, it's not because I use them like you. I'm not insulting you or like the average doctor. I use it at a dose that's therapeutic. And because I'm an MD, I use evidence-based medicine. I measure things. So there's no criticism of understanding what I'm doing because I've got measurements before, I've got measurements after. And the biggest measurement is outcome. I lower the blood pressure, lower the blood sugar, help lose weight, lower autoimmune disease. That's the proof. The proof is the result. So it's no good having lots of degrees in your name if your office is full and you haven't fixed anybody, because you know what that means. I don't have to repeat myself. Doc, I have hypothyroidism with anemia. What should I do? Well, I can't diagnose on the phone, so on social media. Look, listen, this is for information education purposes. I'm not here to diagnose and treat, but I'm educating you so you can talk to your doctor. But for theoretically, if you have hypothyroidism, it means your antibodies attack your thyroid. So you got to find out what's making your immune system dysfunctional. Remember, I kind of touched on autism. The damage was done in utero or before conception. The mother's immune system and the antibodies travel through the placenta and then interfere the damage with the neuronal system. And then when the baby's born, they start with autism. So look, I just use it as an example. What I'm trying to say is that immune dysregulation amongst inflammation and oxidation are actually at the root. Now, there may be other things at the root, but all those things actually curtail, block longevity. And they are actually the prerequisites to disease. And that's what will allow blood pressure and sugar and damage your organs. So when you have your immune system that's dysfunctional, those antibodies can not only affect your thyroid, it can affect any organ in the body. So what is it that causes insulin resistance? What is it that makes blood sugar difficult to control? Your immune dysregulation. People that have immune problems, they have either inflammation by itself or they damage the insulin receptor because of immunologic, like tumor necrosis factor. So if you have those things, then you're going to damage the other hormonal receptors. So thyroid is a hormone, the pancreas is hormone, the ovaries are hormone, growth hormone is a hormone, right? Everything is hormonal. So you got to not damage. You remember the principle of what I said about longevity? Don't damage those longevity genes like nitric oxide synthase, and don't damage sirtuins. Don't damage heat shock proteins. So hopefully that helps. Now, anemia is 3 types of anemia generally. Either you could be losing blood, like in periods, that's acceptable. We call that microcytic anemia. If you have a macrocytic anemia, which is somewhat rare, that's when you have something like liver disease or vitamin B12 or folic acid deficiency. And the one in the middle, we call it normocytic normochronic anemia. That can be from chronic disease, like chronic kidney disease, chronic liver disease, because you lack erythropoietin. Now, that's not to give you a treatment plan. That's just to give you some information. So because, for people who don't know, I'm a real doctor. So an MD, that means that I know everything that most doctors know, and I know a lot more than they don't know because they don't know how to prevent disease. So Next Health, the plug for Next Health, is about rethinking medicine, right? Rethinking medicine is not doing what every other doctor does. If I did what every other doctor does, I'd get the same crappy results. Bad word, sorry. Rethink medicine means I have to have the tools to predict things so I can prevent them. Should you have it, I can reverse it. And that's what Rethink Medicine is predicting, preventing, and prolonging life. And then I utilize my Ultra Health program for people who need it to build up their immune system, to build up the intracellular nutrients, to build up their body so that they can manage by themselves. So I can do that with my Ultra Health program. Is smoked salmon okay? Well, to a degree. I mean, if you can get wild smoked salmon, that's good. But the whole process of smoking could have some detrimental impact, because when you use preservatives, and this is probably universally true, when you use preservatives, then you are going to impact the microbial flora. So I give smoked salmon to my kids because it's a good source. I mean, certainly better than cream cheese. But so what I would do is I would give them smoked salmon, wild smoked salmon, on an infrequent basis. Not every day, not even once a week, but I would give it to them. Yeah, even cold cuts, I give it to them. But they got to live a little bit. Is fish oil? We're going to mention that one. Great, good questions, excellent. So hopefully people are enjoying this kind of conversation. So if you enjoy this kind of conversation, which I know you love it, so share it with people, because it's about educating them, because then they can go to the doctor and ask good questions. Otherwise, you become very passive. And when you're passive, the doctors just love to just send you out the door with a prescription and having to answer no questions. But when you are educated, you can ask questions, and they'll probably open the door to kick you out because that's unfortunately how they are. Okay, thanks very much, Diane, for that. We miss you. You need to get back in here so we can continue the good work. All right. Why wild salmon as opposed to farm raised? Yeah, so it's a good question. Why do people say why wild over farm raised? So if you, I go grocery shopping. I don't know if you do, but you should. Then you can see what you eat. And, salmon didn't come out of wrapping, nor did chicken, to come from a farm. That's just a joke for young kids. Somebody said, asked the kid, well, so how do you get chocolate milk? He said, brown cows. Like, okay. I don't blame the kid. I blame the parents. Anyway, let's go back to serious stuff. So if you ever look at the salmon, and people love to see pink salmon, right? They read the ingredients. The salmon are fed color to get the pink in their flesh. If that doesn't scare you, I don't know what will. So wild is wild. So if you get pink from the wild, that's because it's natural. And so if I ever, and it's not that I don't have farmed salmon, but I get the palest looking farmed salmon because I don't want as much additives. I don't need the redness if I'm going to have farm raised. Now, so on a serious note, so what you eat is being stored in your tissues. And what you eat is circulating in your body, and not only in your tissues, but your body tries to accommodate them by pulling them into your fat, which is a good thing, because you don't want them circulating around the body and around the brain because you feel terrible. However, the problem is, at a certain point in time, that fat then sends inflammatory signals. So you have to be very careful that just like the salmon that's being fed color to make its flesh colorful, when you eat bad stuff, it's in your body. Yes, your liver's trying to get rid of it, your kidney's trying to get rid of it. So we'll talk about that another day, about the next phase. So next one, maybe we'll talk about nutrients that accelerate or slow down the aging process, or activate longevity genes. Then we can talk about how the organs themselves, the liver and the gut, how they are vitally important in keeping your body clean. Because if you don't succeed and you get overwhelmed and overburdened, then that it turns on you. So when you have enough toxins in your fat, your adiponectin goes down. What happens then is that then you gain weight, because adiponectin, when it's higher, is good for you and is synonymous with a stronger immune system, less inflammation, and better insulin receptors. Now, when your insulin receptor is not working well, you get what's called insulin resistance, then you gain weight. So you and I could eat the same amount of carbohydrates. So we both eat an apple, should we say. If one of us has insulin resistance, then we will gain weight compared to the other one, because insulin resistance means that for that same apple, that one person with insulin resistance has to spike their insulin. When the insulin spikes, your body holds on to fat. So I'm just going laterally a little bit. Are you currently doing any evidence-based research now on this topic or any other? Well, so mine is not, at research like going into a lab or research with Dr. Habib. Mine is just with clinical practice. So when I incorporate all the things I tell you, is that I have people before and I have people after. So that's my evidence. So if they have inflammation, I turn it off. If they have liver toxicity, I bring it down. If the gamma GT is high, I lower it. If they have insulin resistance, I bring it down or turn it off. So it's called evidence-based medicine. If the thyroid antibodies are up and I bring it down, or the function is low and I make the function higher, the vitamin D is low, so I can go on and on and on. So this is clinical practice. So that is the clinical research. How can we reverse this process? Yeah, by understanding what causes the problems. And yeah, I appreciate you coming on live. Again, if you like what you hear, then pass it on to anybody and everybody so that they can get involved and ask hard questions. I'll be happy. Medical, non-medical. There's a Dr. SF who asked questions yesterday. Let's see what it's about here. Are you currently doing it? Well, that's you, yeah. Evidence. Well, that is evidence. So what we're doing is using conventional evidence-based medicine. We're using research evidence about longevity. We're using research about how the autonomic system, the brain, impacts inflammation in the immune system, and I put it into clinical practice. And so one of the greatest tools that I have, in addition to the meal plan and the lifestyle like fasting, and then the supplementation, then the IV vitamins, is to use my hyperbaric chamber in that combination to get the maximum stem cell regeneration and maximum rejuvenation, and incorporate the final study, which came out from University of Tel Aviv, which is say that if people use the hyperbaric often enough, intense enough, they can actually reverse the aging process. So thank you very much for joining. I really appreciate it. I'm cutting it a little bit shorter today so that you can digest the information that I said. And so just remember, activating the longevity genes isn't just so you live forever. It isn't just a cosmetic thing so you look wonderful. It's actually the cornerstone of preventing disease. And that's why most doctors don't know how to prevent disease. They talk about an annual physical as a way to prevent disease. That is the most biggest amount of, I won't use a bad word, but you know what I'm saying. I can't even find a word bad enough to insult them. I mean, they're just such bad doctors. And so, you're welcome, if you're an MD, line up on social media and get a good old verbal abuse from me so you can go back to your book and start to get educated again. Because if you're still practicing the same thing you did 10 or 20 years ago, you're obsolete. The only thing that's saving you is that 90% of doctors are practicing obsolete medicine, so you can pretend to defend each other, just like the politicians defend each other by lying and not explaining the facts and the truth. So if you're just like a politician, then you're just as bad as a politician, and you should lose your license. Yeah, and one day maybe I'll be in a position to take your license, and for that day. Anyway, sorry about that. I just go off at a tangent. All right, what else? Yep, so listen, it's Friday. Enjoy the weekend. But the main thing is get a good night's sleep. Wake up hopefully feeling rested. Don't put too much into your body. Don't do any refined stuff. Go out, walk a little bit or a little bit more than that. Be happy. Have a great weekend. All right. Thanks for joining. Take care. Bye-bye. 176.